This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Welcome, everyone. Thank you, PM&R Scholars, for allowing us to present and share the floor with some really great programs. We're very excited to explain to you a little bit more about our program, and we're going to just start off with some introductions. I'm Priscilla Mapelli. I'm a PGY3, and then I'll hand it off to Mitch.
My name is Mitch, also one of the PGY3s. Welcome, everyone.
Hi, thanks for joining, everyone. My name is Ariana. I'm one of the PGY2s.
Hi, everyone. My name is Jay. I'm one of the PGY2s as well.
Right. So the University of Connecticut, or UConn, PM&R residency program is a great collaboration between three main affiliate sites: Hartford Healthcare, Gaylord, and UConn. They're of different levels of care, and also representing a lot of socioeconomic statuses across the state, as well as a very diverse patient population. Some fast facts about us. We're the first PM&R program.
Priscilla, are you sharing the slides?
Yes.
Oh, I don't see anything on the screen. I'm not sure if anyone else can.
We can't see the slides.
Nope. Okay, let me do this one more time.
Okay.
All right. Sorry about that, everyone. Okay.
Awesome.
Now we got it. Perfect. You guys didn't miss much, don't worry. Just a slide about our three sites. Some fun facts about us is we're the first PM&R program in Connecticut. Definitely not the last. We have a really great group coming up in Yale as well. And we're really excited about that, to have that growing in our state. We're the first class, the PGY3s. We started in July of 2022. We're a 4-year categorical program. So just as a refresher, categorical means that your first year, your PGY 1-year intern year, is going to be at UConn as well. And then we have 4 residents per class, and it's a multi-training site type of program.
I get the pleasure of talking to you about a little bit more about our facilities and different hospitals we rotate at. I'll first talk about UConn Health. You'll spend about half of your intern year here, as well as some time during PGY 3 and 4 for interventional spine. So UConn Health, if you want to go to the next slide, is a level 3 trauma center. It's about a 234-bed hospital. It's a large academic institution. It houses the School of Medicine, the dental school, as well as School of Nursing, Allied Health. There is a large residency and fellowship programs here, about 55 accredited programs. Through that comes a lot of research opportunities through the Bioscience of Connecticut, UConn Health, as well as Jackson Laboratories. Next, we'll go into Hartford Healthcare. You'll spend about half your intern here as well as majority of your PGY 2 through 4. Hartford is a level 1 trauma center. If you want to go to the next slide. It's an 867-bed hospital. This is also where we have our acute inpatient rehab unit. It's a 26-bed unit, state-of-the-art gym and facilities. We have access to all the state-of-the-art equipment, including exoskeleton, a lot of the zero-gravity devices. We do have an ADL suite, which allows patients to practice cooking, doing laundry, as well as transferring in and out of a standard bed. We do have access to the Bone and Joint Institute, where we'll have the opportunity to do athletic performance development, access to sports nutrition, dietitians, psychologists, as well as the amazing state-of-the-art simulation center. At Gaylord Hospital, you'll spend your spinal cord injury, brain injury, as well as some consults and outpatient clinics here. Gaylord is a very unique site. If we go to the next slide, it's actually licensed as a long-term acute care hospital, or an LTAC. It's a 137-bed hospital sprawled over 400 beautiful acres. It functions as a standalone rehab hospital. It has received its 12th consecutive 3-year CARF accreditation for both inpatient and outpatient programs, and special accreditation for spinal cord, stroke, and brain injury. It is part of the model systems through Spalding New England SCI model systems, have ample opportunity for research through the Millen Institute. Adaptive sports, there's over 16 sports going on throughout the year. And also an awesome opportunity in Trorick House, which is kind of a transitional house program. Brain injury patients tend to spend their weeks here through day programs with access to the outpatient therapists, and then go home on the weekends. Some other sites that we rotate at: Hospital for Special Care, the VA, as well as Connecticut Children's. The Hospital for Special Care is also licensed as a long-term acute care hospital, 236-bed. We do have also our outpatient neuromuscular clinic here, aquatic therapy. We spend some inpatient peds here. Through the VA, we'll spend some outpatient rheumatology, outpatient PM&R, and Connecticut Children's, a huge facility, outpatient pediatrics, and an amazing motion lab there as well.
So I'm going to talk a little bit about kind of what the years look like. So intern year, so again, we're a categorical program, so we include the intern year, UConn includes it. So what's nice about that is that the electives and even the schedule just in general are kind of geared towards PM&R training. So what's super unique is we get experience with neuro ICU, different electives like neurology, sports med, radiology, rheumatology. And then as far as another unique thing to UConn's program is that we have something called a PM&R boot camp in June, kind of to get us ready for that transition between intern year and PGY2 year. If you want to go to the next slide. So PGY2 year, also something to mention between PGY1 and PGY2 year that we do is going to PM&R clinic once a month starting in September, which is great to have some PM&R time even during intern year. So other than that, with PGY2, it's mostly inpatient, so general rehab, spinal cord at Gaylord, as well as PM&R consults, which was at Hartford, and then a little bit of outpatient as well with interventional spine pain. There's research thrown in there as well, and rheumatology at the VA hospital in Newington. Third year is mostly outpatient, but we do TBI, like Mitch said, at Gaylord Hospital, and then just kind of a mix of outpatient stuff. I'm not going to read through all of this just for the sake of time. And we get some EMG during third year, as well as during fourth year. If you want to go to the next slide, Priscilla. And for fourth year, it's a mix of both inpatient and outpatient. So we have peds, consults, and outpatient has a mix of general PM&R, brain injury, spinal cord injury clinic at Gaylord, EMG again, like I said, and then 2 months of elective, as well as leadership, which has to do with kind of like working with hospital and leadership department, kind of learning like the legal and business ins and outs of medicine.
So we have a dedicated didactic time that you'll participate in during your PGY 2, 3, and 4 year, as well as occasionally on your PGY 1 year, depending on elective rotation that you're on. So these didactics occur every Tuesday morning. And again, this is protected time, and the lectures go through an 18-month rotation. So we repeat every 18 months. One of the nice things about being in a multi-center residency is we get subject matter experts to come talk to us. So it's not just our faculty giving these lectures, it's experts in the field from all across all 3 institutions or 4 institutions that we practice with to get the best information available. We also do workshops monthly. So this will be in the afternoons on those Tuesdays. Once a month, we have some type of procedural skills or workshop to help hone our skills a little bit better. And then we also do monthly journal clubs. So call schedule is something that we're very proud of at the UConn program. So in your PGY 1 year, it's going to be heavier on call than the rest of your years. You follow the same thing as the internal medicine call. So when you're on a floors or ICU block, you're going to have great weekends every week that you're on. And then You also will have 2 long call shifts per week at UConn and 2 to 3 long call shifts per week at Hartford Hospital, which essentially just means that, sorry, can we go back a
Yep.
couple slides?
Yep. There you go.
Which essentially just means you're going to have a couple extra hours at the end of the day to field any late admissions before the night team gets there, and any emergencies. PGY 2-year, we have 6 weekends of call a year, and this happens when you're on those inpatient rehab rotations. And then when you're on call, it's really just for admissions and rehab emergencies. And then pretty stoked during PGY 3 and 4-year, there's no weekend or night call. Some opportunities that the program has that we're very, very excited about. With these institutions that we're affiliated with, they're all wonderful research institutions, and they're all very happy to have us do research with them. As you can see, the 3 listed here. And then also Gaylord, as Mitch touched on, they have a wonderful adaptive sports program that they're more than happy to have the residents come volunteer with whenever we want. And a little plug to them, they have a national championship sled hockey team, which is super exciting. And then for anyone who's interested in sports, we have a very diverse sports medicine network in Connecticut throughout UConn, Hartford Hospital, and Gaylord. And the faculty there are great and are very willing to have residents come cover events with them whenever they want.
Yep. And then other unique opportunities that UConn provides is opportunities for global health initiatives. And you're more than welcome to do it outside of the scope of PM&R, but we're very fortunate to have our program director have a 20-year relationship with a hospital in Peru and do a prosthetic and orthotics project out there every year. And then on top of that, in terms of thinking globally and acting locally, if you don't have the opportunity to go out and travel abroad, we do have lots of volunteer opportunities, specifically with Hartford Healthcare and the medical mission, serving a lot of the population that are uninsured or have not fully insured. And then also the South Park Clinic with our unhoused population as well. And then in terms of wellness, we have quite a bit of things that we like to do. A lot of team building exercises, paint and sip, happy hour. It's basically what we want to do. It's a very new program. We are building the culture actively, and I feel like we're pretty proud of it. I might be a little biased, but there's lots of opportunities to even like just go out and see different athletics, like AAA baseball. The stadium is pretty nice. And then we have department-wide type of events, specifically 2, one in the summer to kind of welcome all the new residents in, and you get to meet the staff, faculty, teaching attendings, as well as in December, we get together again for the holidays. And then in terms of benefits, we have really, really good healthcare coverage. I'm not going to go into every single detail of it, but it's fairly good. So if you're thinking about this is a time in your life where you want to start planning for things outside of medicine, you definitely have those resources here for you. And then we have a really pretty good educational stipend, as well as conference allowance and free parking, which is super key at all our sites. And then living in Connecticut, many of the other programs will probably touch upon this in the New England area. We're pretty condensed, so you'll have pretty good access to very, very big cities, as well as the 4 seasons in general. Connecticut's nice because you can have that more metropolitan feel, but also go out into more of the spacious countryside. And then there's lots of festivals and different opportunities throughout the year to just kind of enjoy yourself and find your niche. And we live primarily in the greater Hartford area. And then this is our leadership. Our program director is Dr. Sitharama. Dr. Rosenblum and Dr. DeGrucci are our associate program directors, and our program coordinator is Stacy Hines. So feel free to reach out to her with any questions. We'll be also putting our emails in the chat, and you guys are more than welcome to reach out to us about any of these details in the PowerPoint, which you'll also have access to. And a little plug for our Instagram, our little resident on Instagram, to see what we're doing. So we'd like to thank PM&R Scholars once again for allowing us to present, and I think we have time for questions if anybody has any.
Okay, so there's a question in the chat. In terms of categorical programs, is there a scenario where you could possibly also match into a transitional year prelim program, or is there a system in place to avoid this? So I think it's kind of one or the other from what, I mean, I applied both to categorical and prelim plus advanced year program. So if you match in a categorical program, you are automatically taken out of the prelim TY. It's automatically taken out of the match list. So that is not possible from my understanding. If anyone else wants to comment on that, but. So there's more questions in the chat. I don't know if you guys are seeing. Is there a hard cutoff for step 2 CK scores? I don't think so. I think it's more of a holistic application kind of thing. I think one of the biggest things you'll hear, and this isn't just for UConn, but just in general, is showing interest in PM&R. So whether it's volunteer work, research, extracurriculars, like whatever it is, I think, I don't know if how heavily they focus on step 2.
Yeah, I will say there's not necessarily a hard cutoff. Our program director and as well as assistant program directors do a great job at looking at applicants holistically. They read every application that comes in, read every personal statement. So if you're interested, would certainly recommend applying.
And then I'll go ahead and take the next question. It says, how often do y'all do the global health trips? So specifically the PM&R global health trip with Dr. Sitharama, that is once a year. And then if you decide that you want to go with another group, say like infectious disease, and they happen to do like an ultrasound there and you want to practice injections or whatnot, that's going to be dependent on that specific contact. I know in the beginning of the year, they kind of have like a small global health fair with all of UConn GME. So you can go and attend that and kind of communicate with those contacts and those attendings who have projects going on. And it's basically going to be on kind of their timeline. And then, is there any formal mentorship structure within the program, or do residents tend to seek out mentorship on their own? Yes. So you will get the option to choose a mentor based on your professional wants and needs. And then also we do an informal one peer-to-peer kind of with another co-resident. So that is incorporated into your PGY 2 year, where you will get to select your mentor. And then sometimes we'll have the option of switching. We had that flexibility since there was, we're just starting out. So there was more attendings to residents, but there's always exceptions that can be made, and it's pretty fluid. And there are also informal kind of mentorships that happen because our attendings are very close with us and we have their cell phones and they love picking our brains and we love picking their brains about things outside of medicine as well as within medicine. What's life like as an early years in your attending?
Next question, how are the winters? Important question. Yeah, so in the Northeast here, the winters can get a little cold. I will say in recent years, they've been a bit milder than I remember growing up. However, you'll be chugging along and then get towards the end of November, like mid-December, and it'll drop off pretty quick and you'll be in, freezing temps, could be 20s, 30s. And then in February, it can get even colder, but then once spring hits, it's nice again. So you get a few months there that are pretty cold.
Yep. And then
2 minutes remaining.
Oh, thank you. And then how do you feel your program runs with it being young? I think it runs as good as it can get. We bring up suggestions. It's a very fluid conversation with our program directors and associate program directors. And they're actually very responsive and they change things very quickly. They don't like to wait because they want to make sure that we're getting the best opportunities possible. One biggest example was during our intern year, when Mitch and I were interns, they initially wanted us to do like a general like internal medicine clinic with the rest of the IM residents, but then we decided like if we could have the opportunity to do a PM&R specific clinic, and we brought that up with the our program directors, and they made it happen, which is not an easy feat to do. And then anything that comes up, they constantly are checking in with us and trying their best to kind of make sure that our education is the #1 priority.
And I think one of the big things to remember about us being a young program is, we are part of UConn Health, which again has 55 different residency and fellowships. So yes, new program within PM&R, but very, very established graduate medical education system here.
And does our program have any IMGs? To my recollection, I don't believe we have any yet, but we are open. So don't count yourself out if you're an IMG. Send your application in. We look at everything very holistically. Alrighty, it looks like that's mainly it for questions. Feel free once again to just email us with any questions that are just itching, and we'll get back to you as soon as we can. But thank you again for allowing us to share everything about us and asking really good questions.
Thank you all
Thanks
so much.
everyone for being here. We'll put our emails in the chat.
Thank you. Have a good night, everyone.